Hi, I'm Louise from sriYoga. This is part one of our series on how yoga therapy is very helpful for depression and the blues and low mood. Anxiety and depression are one of the same in the sense that in both scenarios the mind is disturbed, both of varying degrees, but also varying in the cause of why you're feeling that way. We will focus on depression today, but with any of these mental health issues, we want to create long-lasting positive effects. So for neural pathways to change, we need to repeat the same practice for a period of time. So if we chop and change it, we don't get the opportunity to change those neural pathways and establish a new pattern. So my recommendation to you is to follow the practice, and if it suits you, and if it doesn't, you can contact us and we can do something else and tailor it for you, is that you do it every day for you to see some change. It's not a quick fix like a lot of other things are. In this process, you've got to give the mind, body, breath, emotions time to shift. So I'm going to give you a practice today. How we're going to elevate you, what I want to do is usually when you've got a low mood, the energy is low. So then you don't feel great. Mentally you start to feel heavy, you feel depleted, and as I said, the causes are quite different for everyone. So I'm going to show you a practice. We're focusing on the breath, but we're using the body to help to build the breath to elevate you and feel better. All right, so we are going to start on the floor. These therapeutic practices are really, really simple, and there's usually only about 3 or 4 postures, but the focus is on the breath. Now, when I ask you to pause for 2 seconds after the inhale, that means you just stop for 2 seconds and don't breathe. And when you stop or pause for 2 seconds after exhale, you're going to just let all the air out and then stop the breath for 2 seconds. All right, but we're going to focus on the inhale, which energizes us. So we're going to start sitting, arms by the side, breathing in, coming up. When your inhale finishes, you're going to stop the breath for 1, 2. Breathing out, take your pelvis back, fold down, elbows bent, release the head. And you only pause for about a second after exhale. Inhale, come forward. Onto the hands and knees. Our head can be here. Hold 2 seconds. Breathe out. Elbows come down. Hands under the shoulders come up. Hold 2 seconds. And breathe out, coming down. So I'm going to do that for you again. And what I want you to do in your daily practice is do it 4 times. So you breathe in. Breathe out. Breathe in. Pause, no breathing. Breathe out. Hands under the shoulders, breathe in, nice big movement, arms open the chest, fill the heart space with vitality, 2 seconds. And breathe out. And just be still, and you're going to repeat that 4 times. So the next sequence, we're going to stand quite steady through our feet, spreading the toes, balls of the heels and heels of the feet. And I'm going to ask you to interlace the fingers and turn the palms down. Now, if you have sore shoulders, don't worry. You can just take the arms apart, okay? So from here, you're breathing in. And this time, we're going to hold the breath after inhale 3 seconds. 1, 2, 3. Exhale. Let go. And again, breathe in. Hold the breath in. 1, 2, 3. Exhale. And then you repeat that another couple of times. So you can do each sequence 4 to 6 times, as long as you're focusing on the breath, okay? Next posture, we're going to the back of your mat. You're going to take your left leg forward, but just making sure you're not on a tight rope like that. Step your leg out a little bit to allow your hips to move a little. Turn your back toes out on a slight angle, okay? So from here, you're going to inhale. Feeling this heart space where you hold your vitality, hold it in 3 seconds. Exhale. And of course, if it's too much to hold for 3, you pull it back to 2. Breathing in. So 4, you can build to 6 times on each side. So we're just going to change sides. Breathing in. Arms nice and wide, so this heart space opens, building your vitality. So 4 or 6 times on the other side. Then we're going to come down onto the floor again before we do our pranayama practice. So from here, we're coming up, breathing in, and just feel the power of opening up those arms, lifting up through the heart space, staying 3, you can build it to 4 seconds. And breathe out. Breathing in, hold, and repeat that as well. Then before we do the next part, you're just going to release the hands, and I want you just to rest the breath, rest the body for a few moments, at least 30 seconds, before we do the pranayama practice. Okay, so what I want you to do is place your right hand onto your chest. This is where the focus is going to be. Left hand on the belly. We're going to continue to hold after inhale. So you're probably up to about 3 to 4 seconds. So whatever's comfortable for you. So just watching. We're going to inhale. You'll feel the right hand. Exhale. Inhale. Exhale. And after exhale, you pause for 1 second or 2 seconds. Again. Hold the breath. 1, 2, 3, 4. Exhale. Now I'd like you to repeat that at least 6 times if you can. Make sure you're not out of breath, so you need to reduce your holds if you're getting out of breath. Once you've finished, after any pranayama practice, you need to come home. So you need to come back to your normal state of mind, relax, come back to normal breathing, and then you can get on with your day or your evening. If that practice doesn't suit you, maybe you can't get on the floor, you've got sore shoulders, sore hips, or high blood pressure, contact us so we can tailor that practice for you. And I'll see you next time to develop our next practice.